Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Tracy, it is no secret. We can all learn something from those who went before us, and especially those who were successful no matter what they did. There is just no substitute for experience. Today on Mayo Clinic Radio, our guest is a now retired, longtime obstetrician gynecologist at the Mayo Clinic, a woman's doctor.
He was loved by his patients and received multiple honors and awards during his career, including Teacher of the Year, an Excellence in Teaching Award from Mayo Medical School, a Leadership Award from the Zumbro Valley Medical Society, and a Humanitarian Award from the Mayo Clinic Alumni Association. Here to share some highlights from his career as a physician and as a captain in the United States Army serving in Vietnam is Dr. Robert Stanhope. Welcome to the program.
Thank you very much.
Dr. Stanhope, good to see you.
Nice to see you.
First of all, congratulations on a stellar career. I want to know, how did you keep it going that long?
Well, it was very interesting. I enjoyed taking care of patients, and I enjoyed academic work, and did a little less research than academic work in patient care, but I really love patient care.
Did you ever feel burned out?
No, I didn't.
Well, it's sort of interesting, isn't it? Because there's a lot of talk now about physicians becoming burned out, and the statistics are pretty alarming.
But there are 5% of physicians who are burned out and actually quit. There's 5% of physicians who aren't burned out and have been very productive in their practice.
95% who aren't burned out, you mean?
No.
Is that what you said?
There are 5% for sure who aren't burned out. And there's a number of them who are in the process. And I think the situation is evolving. That is to say, physicians between the age of 55 and 65 are more likely to feel burned out because of the activities and changes that have occurred in medicine, from a paper record to an electronic record to
yeah, it really changed over our lifetime,
fundamentals
didn't it?
for financing and for cost of medicine. And the ones that are between 30 and 45 or so, I think they're doing well. But the ones under 30, I think are excellent. They handle the electronic system so well. I learned from them.
Yeah. Oh, isn't it true? Well, and just like we learned, they learned from us, we learned from them.
That's true.
And they're a lot better at the electronic health record than we.
For sure.
So tell us, why did you decide on a career in medicine? What prompted you?
Well, I have a great-grandfather who was a physician, a homeopath, and a grandfather who was an infectious disease physician and handled tuberculosis at a sanitarium in Milwaukee. And I have a father-in-law who's a physician, and a mom who's a nurse, and a sister who's a nurse. And I, as a young person, decided I was going to go into medicine. I never changed.
It was because of the people around you, family people.
I think because of the people around me.
And why obstetrician, gynecologist?
Well, honestly, I wanted to be an orthopedic surgeon like Tom. And
well, it's very competitive.
I had a girlfriend whose father was president of the American College of OB-GYN. I was consequently influenced. And then in the military, in Vietnam, I had the opportunity to care for a lot of patients. And the soldiers I was in Military Advisory Command, that's MACV, not the U.S. Army Forces, and I was an advisor. And the soldiers were leaving the field of battle and coming home because their wife was pregnant and having a baby. So we turned things around. We established a maternity center for the Vietnamese soldiers and help the wives deliver the babies and care for them so the soldiers could stay in the field. That was a plan, and that worked out very well. And you
brought their pregnant wives over from the United States?
No. I'm not talking about the Americans. I'm talking about the Vietnamese soldiers.
Oh, okay.
And the Vietnamese soldiers would leave the field and be with their wives. So we developed the same practices that we have in the United States in the country of Vietnam for the Vietnamese soldiers and their wives.
Did you volunteer to go to Vietnam?
No.
And so were you on the Berry plan?
I was the Berry plan.
They let you finish
immediately
so much
after my internship. I was shipped off.
And so you were doing everything over there, not just OB-GYN.
I was primarily taking care of the military advisors in those units, the American and military advisors. I was their doctor, but I was also the advisor to the Vietnamese military.
Now, you came home with a Bronze Star, didn't you?
2 of them.
What was that for?
It was for the service in the military for the leadership that I was able to accomplish.
And didn't they name a hospital over there or a maternity?
Well, that was the maternity pavilion. They did call it the Q-Ho-San Stanhope Maternity Pavilion.
Oh, yeah. Pretty impressive.
What's been the most satisfying part of your career?
Oh, practicing at Mayo. Mm-hmm. Absolutely.
But you weren't always here.
No, I wasn't.
Where were you before you came to Mayo?
Well, I trained in a residency at Parkland Memorial Hospital, University of Texas, and then did specialty training at MD Anderson Hospital. And then my first job was at Northwestern University Memorial Hospital.
So Parkland is where they took John F. Kennedy when he was shot in
Right.
Dallas. And it's a huge hospital, big trauma center.
Big trauma
Was
center.
that a good
Great
training?
practice.
Was it?
Great practice. They have 8,000 deliveries a year, and just residents are taking care of most everything, and it's good.
Tom told me that you've done some mission work as well.
I've done a lot of mission work, and I enjoy that as well.
What do you do?
Well, I do surgery. I've done surgery in Mongolia. I've done surgery in Haiti, a lot of surgery in Haiti. I've done surgery in Guinea and Kenya.
What do the patients there need from you?
Well, a lot of the patients in some of those countries had huge uterus, huge fibroid tumors, and bleeding and problems like that. And I was able to teach some of those younger colleagues some of the things I learned at Mayo and elsewhere.
And that was mostly taking out the uterus?
Yes.
So
Yes. I mean,
those are benign tumors of the uterus, but they can enlarge
Yes.
the uterus significantly?
Yeah.
So did you take care of just women when you were on these mission trips?
Yes.
You know, I think is interesting, just like Will and Charlie Mayo, you were training people in Vietnam, you were training people in Haiti, wherever you went, how to do those surgeries to remove the fibroids, or that's very much like what Will and Charlie did.
Well, I had never thought about that, but that's true. Will and Charlie did a lot of gynecologic surgery.
If you had it to do over again, would you still go into OB-GYN or would you be an orthopedic surgeon?
That's a very good question.
You could have worked with Tom.
Yeah.
Yes, but
He's close enough anyway. We're neighbors.
I married the daughter of a president of the American College of Obstetricians and Gynecology. So I was influenced. I was influenced, but I am really pleased.
You do it all over
I
again.
do it again.
And did the tradition of Stanhope's in medicine continue? Any of your kids or grandkids go into medicine?
Well, it's very interesting. I have a son-in-law that's an anesthesiologist, and I have a daughter who has practiced nursing to a degree, and but my most of my family, I think my grandsons are going to go into medicine.
Oh, I hope so.
I
I
hope
love
so,
Grandpa,
too.
I'm sure.
Yeah.
So what would you tell a young person,
those
family?
those grandkids.
Yeah. If they were talking about a career in medicine, would you encourage them?
I would encourage them very much.
Been a fabulous career for
It's
you.
been an excellent career.
And you do it all over again.
I would do it over again. In fact,
And it was almost
I
as
didn't
good as
really want to
orthopedics.
retire.
Yeah, but you quit doing surgery but you continued to work as a medical
Yes.
obstetrician gynecologist.
Yes, I quit during surgery about 6 years ago, and then I did medical gynecology at Mayo for 2 days a week, and then was in Red Wing, part of Mayo's system, and did surgery for 3 years there. I haven't done surgery in 2 years, but I'm okay now.
Yeah. Yeah, but you mow the lawn, and I see you take down trees and everything else. So, yeah, you're still doing
Your
surgery. in a way.
neighbors.
That's right. Dr. Robert Stanhope, a long, productive, extraordinary career as an obstetrician gynecologist at the Mayo Clinic. Now, he not only cared for women in the United States, he spent a great deal of time caring for women in low-income and low-resource countries around the world. Truly an exceptional and a noble medical career. Dr. Robert Stanhope, thanks so much for being with us.
Thank you for having me.